Me personally, I think when I see SATA question, put them into a different category. And when you do that, it becomes easier for you. And so these are the 5 questions, type of SATA questions you will see. Try to put them in this one of this category. It will make life easier. Do a couple of questions, and then you see how you can apply it. You can apply that information. So this is a pathophysiological question, SATA question that using pathophysiology. So it's a SATA question. A client is diagnosed with SIDH. Which of the following is expected? So in a patient with SIDH, and what does ADH do? It causes reabsorption of free water from the kidney and prevent your kidney from getting rid of this free water. So you have too much free water than anything in your system. So if I'm absorbing all free water, well, my kidney will not be able to put out any urine. If you put out the urine, there will be less water in it. Therefore, your urine will be concentrated. Okay, concentrated urine, or it will be dark. If you're absorbing all the urine, well, your urine output will decrease. If I'm absorbing all the water fluid, then I will get fluid overloaded. If I'm fluid overloaded, well, my sodium will go down. So you see what I'm doing? I'm just making SATA question from SIDH. So if you know the underlying problem, the key word is ADH, is I'm absorbing all my water and the kidney cannot get rid of water. And so the urine the kidney is putting out is very concentrated, very small urine. And you can use that information to answer any question. You don't have to memorize, you can deduce from it. So based on that, if I'm absorbing a bunch of water and I'm not urinating, peeing them out, well, I'm going to gain weight because I'm taking too much fluid. Your lower extremities edema. Well, if I'm taking too much free water, I'll gain weight. If I gain weight, I'll have what? Edema. Low level of ADH based on the pathophysiology, syndrome of inappropriate ADH. Well, ADH should be high. Prescription of democycline. This one, you just have to know it. This antagonized ADH, basically, so you go to the kidney and prevent ADH from doing its job. So ADH will stop absorbing water. So that is the prescription your doctor will give. Prescription for conivaptin. Look at the last word, vaptin. You don't even have to know the first word. And put this in your head. Patients with SIDH, one of the medication we use is vaptin. These also go to the kidney and antagonize ADH. So it blocks ADH from absorbing water. So you can use it too, these two medications. High urine sodium. This is your urine and there is no water in it. There's no water. All you have is electrolytes. And the kidney is absorbing every water, and the urine that is coming out is really concentrated and is dark and is smell because of the chemicals. Therefore, you expect the sodium to go up in the urine. Any chemicals in a electrolyte in that urine, you expect to be high. So high urine sodium. High serum osmolarity. This cannot be based on the pathophysiology. We're absorbing a lot of water and we're holding on to too much water. Our blood will be dilute. Anything in our blood will be dilute. So the osmolarity means concentration. So serum osmolarity will go down. So this is wrong. Seizure precaution. This is application. Your sodium is going down in the serum. You get hyponatremia. And one of the risk factors for a side effect of hyponatremia is seizure. That's why hyponatremia is really bad. And if you look at B sharp my prioritization, you see electrolyte, and hyponatremia is one of them. And therefore, this is good. So you have 1, 2, 4, 5, 6, and 8. So you see what I've done? Pathophysiology with the SATA question made easy. Next question. Now we go to risk factors. Okay, we go to risk factors. I told you every disease process based on the pathophysiology, you can deduce the risk factors, what can cause that problem. So a client was diagnosed with what? Hepatitis B. So he has Hep B. Which question should the nurse ask? Okay. So which question should the nurse ask? Somebody with Hep B, that what question should the nurse ask the patient? So you know, based on the pathophysiology of the disease, hepatitis B is infection of the liver, okay? And then the common risk factors is easy to remember is B, Hep B. So the risk factors of B, it means body fluid. Body what? Fluid. What is the body fluid? If they're talking about blood, semen, vaginal secretion. And then unprotected sex and IV drug use. These are the risk factors because it's a blood-borne problem. Anything can transmit through the blood. So, or any body fluid. Well, blood, get in contact with blood, body fluid, which is B, and semen, which is body fluid, vaginal secretion, body fluid. And how do you get in contact with them? By having unprotected sex. How do you get in contact with blood? Either transfusion or through needle sticks or IV drug use. You see what I've done? Put it together and it makes sense. Hepatitis B is body fluid. So blood, which is a body fluid, semen and vaginal. And how do you get them? Unprotected sex, or you have a needle stick into the blood. And those are the risk factors. So we're going to use it to answer the question. Do you share needles? Yes. You want to know if they share needles because there is blood contact transmission to needle. What is just the patient has HIV doesn't mean they may have hepatitis B. You cannot assume because it's HIV, so it's get Hep B. So, but they, even though both can get it through IV drug use, you cannot assume that. Trade to blood, so that is a risk factor. Any recent travel? Well, there's nothing in based on the pathophysiology, whether blood, semen, vaginal, IV drug use, so you can choose it. This is for hepatitis A. It's recent travel, so they go out and drink contaminated fluid, or they go to a place where they don't wash their hands. Yeah, they get a Hep A, not Hep B. Any recent raw shellfish. Based on our pathophysiology, we don't see raw shellfish. Shellfish is Hep A, is a common transmission of raw shellfish. You get hepatitis A, so that's wrong. Are you in monogamous relationship? Yeah, this may be because if this you are in monogamous relationship, you may have unprotected sex, but if you you are not, it's a risk factor. So you want to know, but you cannot assume that that is completely true. But that is can be an answer. Are you in monogamous relationship? Yeah, it's a good thing to it's an inference saying that well they have multiple sexual partners. If you have multiple sexual partners, then there will be a risk for a B. Any recent accidental needle stick, we already talked about is the body fluid interaction. So you see how what I've done. I use the pathophysiology. I give the main point of the question, and I assume that there is only one answer choice. Only one answer choice. Forget about the rest of them. They don't exist in my mind. This is another risk factor question. Okay, risk factor question. A nurse assess an older client. Which action does the nurse take to reduce possibility of risk factor, hip fracture? So you still have to analyze the question. So what are our keywords? Hip fracture. So my keyword is what? Hip fracture. And then what are they asking me? They wanted me to look for what does the nurse take to reduce fracture in what? In an older client. So I have three things to look for. Hip fracture, reduce it in an older client. I've simplified the question in that form. Now, then I said to myself, hip fracture in an older client, what will cause them? Older people, well, they lack vitamin D. The main question is asking you is osteoporosis. That's the only thing they're asking you. Older patient, that will cause his hip fracture. So they lack vitamin D. They lack vitamin and calcium, which are the risk factor for hip fracture. Okay, they need to, this will increase their bone mineralization, and that will improve the strength of the bone. And so what do they need? You give them bisphosphonates. And this medication, this is pharmacology, alendronate. If you don't even have to know the actual name, look for dronate. Every time they give you a medication called dronate, yeah, it's a medication that prevents bone reabsorption. It prevents osteoporosis. It prevents your bone from breaking down, and then help stabilize your bone. So older patients need this medication. They call it. And so we give them that. We let them have vitamin D supplement. We give them calcium supplement. They prevent you. You let them stop smoking. Smoking is not good. Smoking causes bone reabsorption, and so they will lose their bone. They develop osteoporosis. And you let them do weight-bearing exercise or exercise program, that isometric exercise, to improve their strength, walking and resistance exercise. So I've used the pathophysiology, and based on that, the things I've given you all are the risk factors to prevent that. So you can say resistance training is good for them. 50 minutes sun exposure 3 to 4 times a week. What do you think? When you expose yourself to the sun, you're getting vitamin D. So this is how the examiner can write it. They don't want to put vitamin D there. They put sun exposure. 15, you need 15 to 30 minutes, 3 to 4 times a week. And that's vitamin D. Increase their fiber intake. You do not see me saying anything like that. It has nothing to do with the pathophysiology. The main idea is to prevent bone breakdown and improve bone strength. So you supplement them, you let them exercise, and you give them some medication. Vitamin D is not, and fiber is not one of them. Encourage dairy product daily. That is vitamin D and calcium from dairy product. Waxed floor with rags. Well, you have you want to prevent, because they are elderly, their bone is not good. They may have osteoporosis, which you're trying to prevent, and so you don't want them to fall, to break their leg. Wax floor is too smooth, and rags too will let them trip and fall. So this is not good. This is good. Encourage bed rest. Like I told you, they need exercise program. Walking is good. Walking and dancing, that's an exercise for the elderly. And so don't let them stay behind and bed rest. This will not improve their bone. And encourage dancing. This is all involved with the pathophysiology. Dancing is an exercise program that will improve their bone strength. And I've used that to answer that question straightforward. Now, we know the pathophysiology, we know the problem, we can use signs and symptoms You can deduce signs and symptoms. What is the patient going to show? Okay, if I know what is causing the problem, that's the pathophysiology and the disease process, I can deduce what kind of symptoms they will show. So a client present with symptoms of left-sided heart failure. What assessment findings should the nurse suspect? So I break down the question in the key form. So he has left heart failure. What would I see? Then you tell yourself, well, what is the pathophysiology of left heart-sided failure? So this is the heart, and this is your the lung is here. Blood flow from the right atrium. So this is the right atrium. Go to the right ventricle through the mitral valve. And from the right ventricle, you go to the lung through the pulmonary artery. This blood has no oxygen in it. So negative oxygen, deoxygenated blood. This is cold blood. It's not warm. And from the lung, oxygen is added to the blood. Okay, so plus oxygen, and you go back to the left atrium, and then left ventricle, and this blood is pumped out to the aorta and go into your system. Unfortunately, when you have left heart failure, the left heart become big, it cannot pump the blood anymore. So blood from the left ventricle is not going to the aorta. Only small amount is going. So blood, what is going to happen? The blood is going to build up, stay in the left atrium and left ventricle. And what will happen? It will go back to where it came from. It will go back into the lung, and they have lung pulmonary congestion. So when you see left heart failure, think about pulmonary congestion. And therefore, all your answer choice should be what? A pulmonary congestion symptoms. That is all pathophysiology, using it to answer this question. So I'm looking for pulmonary symptoms. Anything that has nothing to do with the lung is wrong. So leg edema, no. This is the patient is going to have lung problem. So leg edema is wrong. CVP is 15. When they say CVP, they mean systemic or central venous pressure. Central venous pressure means too much blood in your veins. Okay, too much blood in your veins. And you see that by looking for their JVD. So central venous pressure means high JVD. This is right heart failure symptoms. So the same thing as the leg edema, this is right heart failure symptoms. Based on the pathophysiology, they're supposed to see pulmonary symptoms. Normal CVP is 2 to 8. So 15 is too high. This is the right heart failure. We're talking about left heart failure, and we're supposed to be looking for pulmonary congestion. So this is wrong. Crackles, yes. This is lung. It has something to do with the lung, some fluid in the lung. So good. P and D. This is paroxysmal nocturnal dyspnea. Fancy word, paroxysmal nocturnal dyspnea. Look, you can break it down. Paroxysmal, it just okay intermittently. Long and nocturnal at night, dyspnea. So this patient, they will wake up in sleep and they have shortness of breath. Shortness of breath, it has something to do with the pulmonary congestion. So that's right. Blood thin sputum. Watch for these buzzwords. Your NCLEX examiners like that because it's a tricky word. They don't want to give it away. But what this means is pulmonary edema. Your lung is full of fluid. So if the lung become congested with fluid, the blood vessels break down and you go into the bronchiole. And then when you cough, there's blood stain to your cough. It's a blood stained sputum. Sometimes they call fruity sputum, blood and stained sputum, or pink fruity sputum. That is a pulmonary edema. That is a priority. If you see patient with these symptoms, it's a priority patient. And then B sharp, check my prioritization. You'll see that B sharp is an airway problem. So this is a hepatomegaly, that means big liver. And that is right heart failure. And I never said anything about it. It has nothing to do with the lung. So wrong answer. Dyspnea, yeah. That is something related to the lung. Okay, so that's the right answer. Okay, and ascites fluid in your abdomen is a right heart failure. So that is gone. So you see, it's a pulmonary congestion. I'm looking for pulmonary congestion. Every answer, I'm looking for pulmonary congestion. And remember, you just paying attention to one answer. Don't worry about the other one. Pretend that they are not there. You make a decision and you move on. Never leave it and come back and look at it again. When you do that, you're comparing answers and you get it wrong. Now, as you know the signs and symptoms, you've intervened, you've taken care of the patient, you can teach them some education. You can educate them. If they say something, they're going home, you have to teach them because you know the signs and symptoms, what they need to what for. You know the risk factors, how to prevent complication. Education is mostly a safety issue. So you're providing some safety teaching. So a client underwent hip replacement. The nurse provide teaching at discharge. The nurse determine teaching is successful if the client makes what statement? I will avoid crossing my leg when sitting watching TV. Yes, it's good. I will use assisted device to pick items from the floor. Yeah, don't bend forward too much, 90 degrees. That will cause the prosthesis to come out. That's true. I told my family to have elevated toilet seat. Yes, based on the pathophysiology. I will need a chair, a wheelchair at home. They don't need a wheelchair. When they live in the hospital, they walk in, so they can use a walker, but not a wheelchair. You're just looking at one answer choice. Forget about the other one. Don't compare and make a decision before you move on. I will use handheld shower. Yes, handheld shower doesn't let them bend down at the hip too much. I will have pillow between my knees when in bed. That is good. Perform isometric exercise of the leg. Well, that will strengthen the muscle, and that is good too. So that is the education based on the pathophysiology and the education you know, the things you know that you need to prevent this disease process. You see what we've done? Now, if they say something wrong, you have to intervene based on you know the pathophysiology, you know the risk factors, you know the disease process, signs and symptoms, you have educated them, you can use the education to intervene. The client with major depression present to the head clinic. Which statement require immediate intervention? So once again, the trick, break down the question, find the pathophysiology or underlying problem, and break it down and use it to answer each question. Forget about any other answer choice. So for depression, we have something we call SIGICAP. You can memorize this, but I don't memorize it because I just write it, but I understand what it is. SIGICAP. And these are the symptoms they have. Okay, these are signs and symptoms of depression. SIGICAP. Okay, so they have a sleeping issue. Their sleep go down, up and down. Then interest. They have interest issue. The interest go down. And the G is guilty. So you feel guilty about stuff. Then E is what? energy. The energy is down. C is concentration. This is the concentration. Concentration is down. A, appetite is down. And P is psychomotor retardation. And so the key symptoms of depression is SIGICAP. And you can use this to answer every question. The key things about depression is what you need to worry about. Your number one priority is suicide. And when should you worry about? When they have more energy. When a depressive patient has more energy, that's when you want to worry about. And when did that happen? 2 weeks after you start medication. So when you start somebody on depressive medication, the first 2 weeks, when they start getting better, you should watch. Your priority action as a nurse is suicide. So every depressive patient, your priority, what you need to worry about is suicide. So which statement require immediate intervention? So I'm looking for something that will be suicide, but not something that is expected. So be sharp in a priority question. You're looking for be sharp, not expected. So that's priority. The same thing, I'm looking for something that is not expected, but bad thing. My appetite is still low. We talk about his appetite going down. So that is not a priority. That's wrong. I don't need intervention. I don't enjoy watching football Sundays anymore. Yeah, their interest goes down. So that's not bad. I have given away my favorite car to my high school friend. This is red flag. If they're giving out their belongings to people, that means they don't want to do anything with life anymore. Giving away their money, their stuff, their houses, and everything, they're checking out. So this is, I need to intervene. I have more energy than I have before. I told you, when they're getting better, their energy is good. Their energy is supposed to go down. But when they tell you their energy is going up, that's when you got to watch them and make sure they are not suicidal. So these need immediate intervention. Make sure we're checking on his energy, following them, and make sure they're not going to do anything. I have been sleeping only 4 hours a day, where their sleep goes down and up. So this is an expected finding. I have not gone out with friends for 4 weeks. Isolation is also a red flag. So suicide and one of the symptoms is isolation. When they're isolating from people, you have to worry. So that's giving away their stuff, their energy is improving, and isolating themselves are risk factors for suicide. For a depressive patient, you should pay attention with that. And so you can see how we can tackle SATA question just by using the techniques I've given you guys. You just have to break down the question, know what is asking you. Is this use your pathophysiology for the underlying problem, and then with that pathophysiology, you can have intervention, risk factors, education, and they're all interconnected. Don't just start answering the questions right away, but just sit down and said, what is he asking me? What is the problem? And this is the pathophysiology, and every answer choice should satisfy that problem. Is this true with that question? Does it meet the requirement of the question is asking me by breaking it down and taking the keywords and said, this, does it meet all of them? Then that is the right answer. And so I hope you guys get something out of it. Good luck with your exams, and then best of luck. Thanks for watching.